So, Maria, thank you so much for being on the show.
Oh, I'm so glad to be here. Thank you for having me.
Can we start with just asking why you're so passionate about this? Why are you in this field and doing so much work in it?
Yeah, because I think women's health was always something I was passionate about. That's why I went into OBGYN. And I loved that as an OBGYN, I could help women of all ages. But as my practice developed and women got older and I got older, I started realizing that there were parts to women's health that were underserved, that weren't talked about, and in fact were almost shameful or taboo, even. Um, and it started with menopause. I thought, why are doctors just not asking about menopause and why aren't women talking about this? This was maybe 20 years ago. And thank goodness since then, menopause is really out of the closet and having its moment. And there are lots of celebrities writing books and influencers and panels, and it's keeping me very busy. I'm
Yeah,
all around the country spreading the gospel of menopause and trying to upend medical education so that doctors are better trained. Very, very few doctors in any specialty get training in menopause and its effects. So that's sort of how it started. And then within menopause, I realized there was something even more not talked about, and it was sexual health, really
ah,
sexual health at any age, but
right, right.
specifically what was happening to women as they were going through menopause, what was the sexual fallout, and why were couples who had been married or together for 30 years able to talk about taxes and their kids' college applications and their aging parents, but not about sex.
Hmm.
That blew my mind. And so, as more and more of my menopausal patients were coming in for hot flashes or for painful sex, but never asking about the painful sex, I started preemptively talking to them. And I realized probably 50 to 75% of all my menopausal patients were, in fact, having sexual issues.
Yeah,
And very few knew where to go for help. Very few felt they could talk to a doctor. Very few had ever spoken with a clinician at all. And even fewer felt that a sex therapist was someone they could or should go to.
yeah,
So there was also, I wanted to teach them to take away the stigma and the shame of a sexual issue as something private and shameful and
right.
say it's not different than a thyroid disorder or a bad hair day. There are people who are trained to help you with this, whether it's a dermatologist, a hair salon, a cardiologist, and that you can come to me as someone who has training in this. Or I teach them about ASECT and I say, look it up online. Here's how we can find people in your zip code. And that's been really empowering. I mean,
Yeah.
it's great to help take someone's cancer out or deliver a baby. I'm glad I'm trained to do those things. But I have found helping women with sexual issues so gratifying because they felt they had nowhere to turn.
Yeah. And don't you think that there's a certain amount of resignation? Like somehow, oh, this happens and
Yes,
it's permanent and unchangeable, and I just have to accept it and give up on sex or something, right?
totally, 100%. And that resignation, so that started fascinating me, that concept. And so I'm a nerd, I'm an English major, I love reading books, I love history. And so I started looking historically at the role of for women and for men, and trying to understand, at least in a heterosexual couple sense, what are the messages we learn about sex, even as kids and teens and young adults? And how come we hold on to those messages and those roles and those scripts so tightly, and
Yeah.
we bring them into the bedroom? And then they fail us. In midlife, they fail us
Yes.
because if you're a 23-year-old male, especially if you're learning sex from porn, and you see a woman moaning orgasmically after 3 seconds of penile penetration,
Yeah.
that's what you think is the norm.
Right.
So if your female partner isn't doing that, whether it's at 23, 43, or 63, you're wondering what's wrong with her.
Yeah.
And then when
Or
that
what's wrong with me, right? Sometimes
Yes,
in
or
yeah.
if you're the woman, you're thinking, "What's wrong with me?" Because I watched a Netflix special and the woman seemed to have an orgasm literally, 3 seconds after they start fooling around, and I don't know if I've ever had an orgasm, and I
Yeah.
must be broken, must
Yeah.
be. So couples come to me all the time, either he or she, and they say, "I think something's wrong with her."
Oh,
So the
yeah.
first thing is teaching people what's normal. Normal anatomy, normal rate of orgasm, normal time to orgasm. By the way, where is your clitoris?
Right,
Because
exactly.
sometimes we get really basic. And,
Yes.
the book I use to teach my college age students about anatomy and orgasm is called Come As You Are by Emily
Mhm,
Nagoski. I
mhm.
keep dozens of copies in my office and give them away. But I actually give them to a lot of midlife women who say, honestly, I never learned it. My sex ed class in the '70s was like how to put a condom on a banana,
Yeah, exactly.
and my extent of sexual experience has been missionary position every Friday night at 10 o'clock with my husband, Ed. And, you know, that's it. And they've never thought of sex as for their own pleasure. Sex has been for procreation or for male pleasure. And so
Yeah,
this resignation is very linked to this sense of duty. And
yeah,
we call it duty sex or mercy sex.
right.
And I love the idea of people like you and I opening up conversations so women could feel a, they're not broken, and B, there could be something more for them.
Yeah,
And then C, but there doesn't have to be. You don't have to be that person having an orgasm every time. It's
right,
okay.
right. Well, personally, I find too that sometimes women have enjoyed sex. It has been for their pleasure, but they still hit menopause and the stuff changes and they don't understand there's maybe something they could do about it. Even those
Right,
people sometimes resign.
right,
So,
right.
yeah.
So I think that's where this concept of the bedroom gap came in for me, that
Okay.
I felt like men and women. And by the way, the bedroom gap applies to homosexual couples as well, to people who are abled and disabled, to people of white skin, brown skin, black skin. It's a very universal concept. The concept that there's a miscommunication and a feeling of one partner feels broken, one partner feels, betrayed, one partner feels they don't understand. There's a gap in communication, there's a gap
Mm,
in expectation. What do I expect should happen in our sex life and ability, whether it's erectile dysfunction on his part or orgasms becoming wimpy or not achievable on her part, or just moisture
yeah.
leaving or
Yeah.
or painful sex developing. And this gap seems to widen in midlife. So I coined the term, I made it really broad intentionally because I felt there was a universality to it. And I think this is why the people at TED felt it merited a TED talk, because it could apply kind of globally and universally. But the good news is that it can be closed. I mean, you and I know that there's so many ways to improve things, whether it's
Right.
communication or mindfulness training or, um, you know, um, anti-anxiety medication. Not that I'm advocating that, but or just repairing the tissue that isn't working or fixing
Yeah.
the erectile dysfunction. There's so many ways to address things, right? I'm sure
Is that
you
why
hit some.
it's curious to me? I mean, it just struck me when you said the gap widens as we get
Yeah,
older. Is that
yeah.
is that only because our sexual functioning is changing as we're aging? Is there
I
something
think it's
else
a
that goes
couple
into that
things.
gap growing?
Yes, I think it's the physical changes and hormonal changes, which you alluded to, meaning there's a drop in estrogen for women pretty dramatically around age 50, 51. And we know that this drop in estrogen around 5 years later results in changes in the vulva, vagina, bladder, clitoris, all of it in a very sometimes profound way. Those changes, if you look at the TED Talk, you'll see an animation of the changes in the vagina, a thinning of the walls, a leaving of blood vessels, a degradation of collagen. These are real and
Yeah.
common, and they hit probably. we say at least 50%, but it's probably more like 75 or 80% of all women.
Hmm.
So you're going to have this if you live long enough after menopause, and most of us are living 5 years after menopause. So, yes, it's the physical slash physiologic changes coupled with sometimes a change in libido. Who knows which came first, chicken or egg? Because if something hurts, who wants to have sex, right?
Right, right.
We think the drop in libido relates to a decrease in testosterone, which also happens. Many people don't know that the ovaries make testosterone, that
Hmm.
women make testosterone. And we know it's got to be partially due to this because when people like Dr. Casperson or myself, when we give women testosterone, often the libido does improve. So for some women, I think it's purely hormonal. But for other women, it comes with a lack of ability to focus. Their lives are very complicated. They're dealing with aging parents, growing children. They're usually at the peaks of their careers, which means more mind space is going to work and
Right.
harder to clear the mind for the bedroom. Um, Sometimes they're divorced or even widowed and or single, and they start looking in the mirror saying, "Oh my gosh, look at that wrinkle, look at that mole, my breasts are sagging. Who would want to have sex with me?" So I think there comes a questioning of whether you're attractive.
Yeah. Yeah.
And as we know, society does women no favors because it says you better be skinny and have big boobs and have no wrinkles and, you know, these unrealistic
Yeah,
expectations.
it's almost like these myths and expectations. Like you said, we lived up to them when we were young, maybe not, but they're certainly going to start to fail us by midlife, right?
That's right. Either
Yeah,
you were that and now you're not, you feel the change and the failure that you're not as what you look like at 25, or you never were that and you still aren't that and you
right.
feel even less able to get there. I mean, those are harmful uh, standards we push women to live up to. And I'm
Yes,
not saying it's only that. I'm saying that could be a sliver of it. And don't forget, there's relationship issues too. You could
right.
be having a strained relationship. And so it's hard to want to have sex when you really don't even want to talk to somebody
Yeah,
or you're
exactly. You're not even
sleep
sure you
or
like them anymore. Yeah,
that's right. It's harder to feel attracted to them. I know part of my attraction to my husband is what he's like as a human, not just what he looks like. It's not,
right.
I mean, he is physically attractive to me, but he's such a spectacularly kind, generous, empathic person. And I'm not sure at 18 that that would have been a turn on, but at
Right.
59, it is. It's
Yeah,
part of what draws me to him.
yeah.
So, I think it's multifactorial, don't you?
Yes, absolutely. It's a complicated soup, right? Lots of
Yeah,
ingredients.
yeah, I
So,
like how you put that.
and why, I mean, men are struggling in midlife as well, right? Erectile dysfunction is often starting to show up. Their bodies are also
Yeah.
changing. But it seems like somehow the pressure or the onus is more on women about this. And yet there seems to have been way less study into women's sexual health.
I think this is because men and sex and sexual needs and orgasm and masturbation and just about any term you can link to male sexual function has always been completely acknowledged, accepted, and considered, quote, normal.
Hmm.
And women socioculturally for centuries have been the providers of the receptacle for the pleasure, so to speak, as opposed to we count and we'd like something for ourselves. In fact, it's not a big stretch to say that women and masturbation has makes people wince or women and orgasm makes people wince. Amazon and Facebook still censor the word vagina. So how are we ever we're still far from it.
Yes.
There was a woman who was a congresswoman lobbying, I believe it was in Michigan several years ago for an abortion bill, and she said the word vagina 3 times and they banned her from Congress for a while. I mean, this wasn't
It's
in the
just a body
1750s.
part. Yeah, this is
It's just a
crazy.
body part.
It's an
So
actual
we're
body work part, not a
we're
dirty word, right?
battling so much stigma and shame right? And our society has kept it up, to be honest.
Yeah.
On one hand, we're trying to get menopause out of the box and show women to love their bodies. And on the other hand, we're still censoring words that are just body parts.
Wow.
Um, yeah. So when I trained in medical school in the 90s, and we had anatomy class, and some people were assigned to a male cadaver and other people a female cadaver. And when we got to doing genitalia, the anatomy professor said, to those of you who have a female cadaver, I'm so sorry, there's just not that much to tell you down there, not much going on. Go over and share with the people in the male cadaver.
Oh my
And
God.
that was the extent of us learning clitoris, labia, vagina, urethra, whatever. So he was embarrassed himself. As an anatomy professor, he didn't want to go there.
God,
So
that just
that should,
breaks my brain. I just like head exploding.
right. So think about the doctors in my class who came out of training. Now, luckily for them, most of them didn't go into OBGYN. And so they thought, as an orthopedic surgeon or an ophthalmologist, I'll never have to know this anyway. But what if you went into OB/GYN with that mentality?
Or your or
You know,
urology, right?
or
Yeah.
urology.
Yeah.
Yeah. So
Yeah.
luckily, urologists and OB/GYNs got another crack at learning it. But I think that all physicians should know that it's not just, oh, there's nothing much going on there, right? I
Yeah.
mean, because people go to their primary care or even their cardiologist and say, I can't get an erection anymore, or I can't have
Right.
an orgasm. And yes, they don't have to solve it, but they have to at least know
Yeah,
what's
they've got to be
normal.
informed, right?
Yeah, yeah. So we're trying. I mean, we're trying to change things in medical education. One of my mentors is working hard on that.
Yeah.
Um,
So you mentioned the drop in estrogen, and I think there's a lot
yeah,
of myths and misconceptions. This is something I've talked to, well, Kelly Casperson and some other
yeah,
people about too, but we can't talk enough. What are the misconceptions about using estrogen therapy?
yeah. Those
And why can it,
misconceptions.
how can it be so helpful? Like how's it a game changer?
Yeah. So I think the most important thing to understand is that systemic estrogen, meaning I get it through a patch or a gel or by mouth, but almost nobody uses it by mouth anymore because it goes to the liver and it's more dangerous. Systemic estrogen through the skin is has been shown to be not only super safe and not only not to increase the cancer rate, but to be linked to reducing cancers and improving all cause mortality, meaning you live longer if you're on it. Yay, great. But from a sexual health standpoint, and from a sexual health standpoint, using estrogen after menopause helps keep uh, the genital tissues healthy. But even safer and even more effective is using vaginal estrogen, which, in my opinion, should be over the counter and probably preemptively mailed to every woman 50 and over as a gift from the government and the healthcare system, the CDC and the NIH. If we were to give every woman in this country vaginal estrogen, the amount of money our healthcare system would save from not having UTIs, just urinary tract infections and hospitalizations and antibiotics would be huge. If we
Wow.
gave everyone systemic estrogen, the amount of money we would save from not having hip fractures, osteoporosis, heart attacks would be enormous. But that's
Mhm.
a different topic.
Right.
What's important to you and I is how do we get our genital health better or maintain it? So, as I said, if 5 years after menopause, things start breaking down in the vagina and the vulva, what if you used vaginal estrogen right when you became menopausal? You would preempt that and not get those changes, or at least slow them down. If you haven't done that and you're 62 and you're in pain, or you're 68 and you're not having sex, if you start using vaginal estrogen, by about 3 months out, you will have regenerated a lot of cells. You'll have made new collagen, which makes elasticity and
Mhm.
comfort. You'll have made new blood vessels, which clears bacteria and prevents UTIs, but also allows for moisture with arousal. Because let's be honest, if you're not getting wet, you feel embarrassed and he is aware of that, or your female partner is aware of that, and it sends this message of, I'm not turned on, I don't care,
Yeah. Yeah.
and that's awkward. So what better way to have more moisture than to make it yourself?
Yeah, because
And
adding lube, I mean, yes, it makes it slippery and it's helpful
yeah,
and nothing against lube, but doesn't
no.
totally make up for the changes in tissue if you can, you know,
Right. I
pump
mean,
up
it's
yourself.
cheaper to make it yourself. Plus, then your GYN exams are comfortable. Or even if you masturbate, masturbation is more successful, helpful, good, positive feedback if you can feel yourself getting wet when you get aroused. And I think lube is great. So I do a lot of
Right.
talks about lube and the benefits. And I think the other thing is to take the stigma and shame away from lube. It doesn't mean you failed or you're an old lady. It means you want pleasure.
Yeah.
And here's a hack, okay? If you and your partner are having sex and it's dry and you wish you were more moist and wet, but you just can't get there, turn the conversation about lube on its head. Instead of saying, oh my God, I'm so sorry, but I feel like I just really need this lube right now, don't be apologetic. That implies you're broken or you failed. Say, you know what is such a big turn on is when I even have a little lube and then I'm even more wet and slippery down there. So
Yeah.
it's about scripting and wording. And one of the things I love to do with my patients is script and word and role play things like that. So instead of feeling shame that they're broken, they feel empowered to be proactively aiming for better sex.
Yeah.
And lube, whatever type you use, can be that. So use it as a tool for fun, not as a shameful, I'm sorry, I'm old or
Yeah.
broken.
All
That
right. Well,
makes it's
that leads into an important part of the conversation I wanted to have, which is how can couples who are in midlife or facing some of these challenges talk about this, still connect, grow closer as opposed to more like a desert.
yeah. Well, obviously, we're talking right now about the physical and physiologic changes, and correcting that tissue is one thing. So just let's go back to that for 1 second to remind people that there are safe, effective, available options to actually rehabilitate the tissue and literally turn the clock back, whatever age you are.
Yeah.
If you're 40 and have breast cancer and are taking anti-estrogen medications, you could have the vagina of a 70-year-old. I see it. I see it every day in my
Yeah.
practice. You can, shockingly, this sounds crazy, you can use vaginal estrogen. We have studies from oncologists proving that the vaginal estrogen is not systemic, it's local, and it's safe.
Yeah.
Let's say you can't or don't or won't. You can use something called vaginal moisturizers. These have hyaluronic acid as the active ingredient. These make a wonderful moist environment. They're little suppositories. You use them twice a week. They last about half a week. And I won't mention any brands, but we could certainly list a bunch. There's a bunch on the market now. Sometimes they're expensive, so cheaper ones are actually coming out. So stay
Yeah.
tuned. You can use lube. Now, lube is in the moment, but you may not be using the right kind of lube. So if you use water-based lube, which is the most natural feeling, and after 13 seconds it feels like there's no lube there, you may want to get some silicone lube and mix it. Just blend them so you have something that lasts a little longer. So, we can do a whole lesson on lube sometime if you
Right.
want.
Right.
um, and I just want to make sure that gets underscored that there are things that you can do on your own, just you and ordering online, you and the pharmacy, or you and your clinician.
Okay.
Okay. And then I think when the tissue is healthier, that's its own boost in the brain of I
Right.
don't have the fear because once it hurts, our brains say, I've got to protect that tissue. So when a penis comes near or a sex toy, we squeeze up and clench, and that's called vaginismus. And that's got to be undone. So to
Yeah.
undo that response, you have to fix the tissue. And then sometimes you have to practice with a vibrator or with little vaginal trainers or with a pelvic floor physical therapist. One of those three ways you have to undo that clenching fear kind of response.
Right.
Um, I think you should do more of the talking probably about the therapy part because we know that even if you do all that, you still might just not have interest. or
Yeah.
desire.
Yeah.
And whether that comes from the fact that 3 months ago it hurt and was dry, or trauma in your past, we carry that trauma with us. And if one in just a few college age women is assaulted, and assault is super common, then we know that lots of women carry that trauma,
Right.
or childhood abuse trauma, or a bad marriage trauma, or even just some non-consensual sexual experience. So sometimes it takes, I think, a lot more careful, thoughtful, complex therapy to undo that. Would you
Yeah.
agree?
I do. I do. And the other role of sex therapy in my mind, I mean, I work only with couples, so I'm not doing
Mhm.
intense trauma therapy with one person, but while somebody's pursuing the medical avenues, the physiological
Yeah,
treatment and stuff like that. So much of a sex therapy is about opening up communication and enjoying everything you can for now on the way to fixing this stuff medically, right?
I
Hopefully,
love
there's some
that.
resolution to the sexual dysfunctions. In the meantime, how can you have the best possible sex and change the expectations and change your idea of
Right.
what
And
counts,
and I
all that.
think some of that is undoing the silly tropes we were talking about, that sex equals orgasm,
Right.
or even that
Or
sex equals
penis and
penis and
vagina.
vagina.
Yeah.
Yeah, just take those away as the objectives
Right.
and look more at pleasure,
Yes.
in a broader sense. So what I have patients do, we always start, I'd say G rated, and then go to PG, and then R, and then X if they want. And so I make them have like a little cuddle date once a week. I say, just take your phones away, out of the room, even if you're just sitting together in a big oversized chair where there's some cuddling and touching, but it doesn't have to be genital, or shouldn't be at first, or sexual, and just enjoy being together. Don't talk about politics or taxes or bills or
Or
kids or anything.
children. Right.
Children.
Yeah.
And remember how nice it is, because you were lovers at one point, how nice it is just to be physically close, laugh together, reminisce, the smell of someone's hair or their cologne, or the feel of their shoulder, and anything, and appreciate the joy in that. So we start with that. I also go back to bibliotherapy a lot, which is a very old-fashioned term. Biblio is the Greek word for book, and I'm
Yeah.
Greek, so I love anything that's Greek related. And bibliotherapy refers to the fact that the female brain really responds and sort of stores erotic content that it reads, or that it hears, or that it smells, or that it sees. But more for women than men. I
Hmm.
think the ability to read a trashy beach novel sinks in. It's private. They can internalize it. They can fantasize. They can read a page of a guy on horseback galloping to save a princess, and suddenly that guy can be their husband or their boss at work who they are crushing on, or whatever it is. And we know that when women that the female brain is like a savings account, that you can actually store erotic content in it and save it for later. Meaning, if you and I are reading books and watching Netflix series and storing all this cool erotic content, especially if we're also using estrogen, but testosterone, but I'll get to
Mm.
that. When we put our head on our partner's chest or shoulder at night, innocently, not thinking about sex per se, but just cuddling, it has a more physical sexual feel to it,
Mm.
right? So what is a not necessarily an initiating move for sex, just, I'm going to sleep, I'm going to lay my head on your shoulder because that's always a safe space for me. It's more likely to feel somewhat sexual. Let's
Yeah,
put it
it
that
creates
way.
a door, maybe,
It
right? An
creates a
opportunity,
door.
an
I
opportunity. Yeah,
love, I love how you said that. I love
yeah,
how you said that. And for many women, they need that. We know all about receptive versus spontaneous desire, and that men are more likely to desire sex spontaneously, right? Like go from 0 to 60, so to
right,
speak.
right.
Women need context. They need to have the door opened. They need a little nudge. And for some women, that little nudge comes from reading, or watching a Netflix series that has some steamy scenes, or what I call oral sex, AURAL,
Yeah,
right? Sex that we listen to, which many of my patients cringe when I say that. And I am being funny, but I'm also serious. There are apps out there now,
Right.
like Quinn and others, where you can put some headphones on, finish whatever your 18-hour day has brought to you, and lie on the sofa or in bed and kind of just quietly let that sexual content go from your ears into your brain. And it's a very gentle way to have this happen. You don't have to watch, so much pornography is male directed, male written, and inappropriate for women. But on that topic, there is porn for women, and most women either hate that word, so they assume it's horrible and sort of brush it off. But if you do a little looking, you can find porn that is female created, female content, sort of more what the female brain can accept.
Yeah.
Um, Erica Lust, Lust, is a famous director of pornography aimed at women, and she does a beautiful TED talk. It's worth having people look at her TED
Mm,
talk talking about this. I think it was very well done.
yeah.
Um, so don't be afraid of porn, just find the way it works for you.
Yeah, I think about this, whatever the erotic media is, where it's an app you're listening to, or a book you're reading, or it's video that you're watching, it's okay to find the stuff that kind of flips your switch, whatever that is, and no
That's
judgment.
right.
There's
That's
nothing
right.
wrong, whatever it
And
is. It can be totally romantic, it could be totally kinky, anything in between. But
it's
using that,
private.
this is where
You don't need anyone's permission.
yeah,
It can be
exactly.
whatever
And this
you
is where
like.
the brain is our biggest sex organ comes in, right? That erotic stuff is
100%.
like lighting up our brain, so it does help.
Yeah, and this is where testosterone comes in because it's testosterone's deficiency in the brain that we think leads to decreased libido.
Mm,
So there is, as you know, no FDA approved testosterone for women in the United States. It almost was, but then it wasn't. And I predict in the future there will be. I just don't know when that will be. So,
right.
what sexual medicine specialists like myself do is we either use the male testosterone stuff at 1/10 of the dose, which is a little annoying, or we have compounding pharmacies make us safe, very low female dose testosterone that they apply through the skin. It's just a cream, and you put it like on your upper thigh or something. A teeny little bit will go to the brain, but the female brain is so sensitive to testosterone that it's like, oh, thank you. And it sort of opens these little receptors. I tell people it's like someone opening up a garage door, but now you have to drive the car inside. You meaning you have to fill those receptors with content. And
Yes.
so that's why I give them homework to read, to watch, to listen, whatever flips that switch,
Right.
right?
Right. Well,
So I
thank you
love
so
that.
much. Would you tell people what you have available, how they can reach you, where they could, connect more with you?
Sure. I have a virtual practice. I found that sex and menopause as topics are not necessarily things that I need to have them in my office for. They're really done well virtually. Maybe COVID sort of forced this upon us, but it's been a blessing because
Mhm.
once my TED Talk came out, I was getting calls from women all over the world in other countries. And I thought, well, they can't fly here from Singapore and Buenos Aires. So we started doing them virtually, and it's been wonderfully helpful. I don't usually do couples therapy. I usually just help the women because we
Mhm.
help with the physical and then the emotional and everything else. So my website, which we'll put on, I guess you'll post that
I'll
somewhere,
put that in the
Maria.
show notes. Yeah. Yeah.
Yeah, mariasophoclesmd.com is the best way to reach me.
Okay.
To find a sex therapist in your area, in your zip code, if you think you want a sex therapist. Remember, I'm not a sex therapist. I'm a board certified OBGYN who's spent 20 years studying female sexuality. But it's really put me, I think, in a nice position to be an expert in menopause and sex. So you can go to AASECT, ASECT, right? I'm sure you've listed
.org.
that somewhere.
Yes.
Yeah, asect.org, right. I had to think about it, .org or .com, and put your zip code in and find someone that way. And I'm sure you have other other ways they can get help. But for me, I think my website's probably the easiest way. And I'm happy to help. I'm happy to help guide you to what's right for you.
Great.
Because it's important. You and I talked about this before we started recording that sexual health, is human health.
Yes.
And until we really give that importance for ourselves, we can't really wait for the medical community or insurance companies to advocate for us. I think you listeners have to say, yes, it gives me stress relief. It gives me self-esteem. It makes me closer to my partner. And we know, by the way, there are studies saying it lowers blood pressure, decreases depression. It has so many health benefits. So
Right.
I'm kind of a big believer in sexual health also as a means to long-term physical health and happiness.
Yeah. Yeah. Well, thank you so much for being on the show.
Oh, I've really loved it. Thank you. I hope I didn't talk your ear off.
No, it's wonderful. There's so much to say. So,
Yeah, yeah.